Cancer Center, Bhubaneswar. And I'm glad to inform you that today we are having Dr. STHITI Das, the MD, radiation and oncologist from Apollo Hospital, who is the chief speaker of this evening. We are very grateful to her. She was there in the hospital looking at the patient, but soon after our call, she joined and she has given her kind consent to be with us. I'm really obliged to you, madam. On behalf of all the participants, I welcome you, ma'am.
Thank you. Thank you so much.
अन्य मान को टिके म्यूट कर अन्य मान को म्यूट करिया पे कहा बहुत कॉलर करते साउंड डाउन ठीक.
Yes, sir. May I request all my viewers to, after joining, please mute yourself. Unless otherwise you are asked to open your unmute your speaker. Please don't unmute, please. It's very important for all of us. On behalf of my principal cum president of this webinar, Professor Vijay Kumar Barik, whose blessing, whose able guidance and motivation helps me to organize such seminar on way. See, he was busy with another webinar of youth rectors, that is a district meeting of Bhubaneswar district. So he is there. Soon after, we will conduct this program and he will join very soon. I am glad to inform you all that today our honorable chief guest of this afternoon, Dr. Kali Prasad Mishra, the Vice President of Bharat Scouts and Guides and the State Chief Commissioner of Odisha State Bharat Scouts and Guides. He is with us. Without his blessing, we cannot go ahead. And he is here to inaugurate our program and he will also address us. And we are having our guest of this morning, afternoon. She is Mrs. Subhashree Das, the Director of Institute of Social Development of Odisha. Is very enterprising lady. We'll listen from her. She will give keynote address. Then we are having State Organizing Commissioner Guide, Mrs. DR.NAMITA Das. She will extend a word of thanks on behalf of Odisha State Bharat Scouts and Guides. And we are having Joint State Secretary, Mr. Mihir Ranjan Patnaik. He will start the program with the Scout prayer. So all the viewers, I welcome you to this webinar and welcome the guests to the Google board. To the information that the madam, our chief speaker, madam, there are so many people from outside Odisha. I just want to inform you. There are persons from Scouts and Guides, Rovers and Rangers, Senior Branch of Scouts and Guides, the unit leaders of Scouts and Guides, Rovers and Rangers, that means the school teachers and college teachers. Along with them, there are many principal also. Then we have persons from Jammu and Kashmir, Uttar Pradesh, Madhya Pradesh, Haryana, Greater Mumbai, Central Reserve Police Force, Patna Women's College. Then from Odisha, we are having Satyasai Women's College, BRM College, Kusalishas College, Balanga College, SG College, St. John Ambulance Association, East Red Cross Association. Then we are having NSS students and Chhatarpur Women's College. That is a very big fitness club, fun and fitness club. They witness our program. Mrs. Beena Das, the chairperson of Puri Lions Club. Then we are having Principal Imarti Devi College, Dr. Khan, with all his members. Then others, Odisha, others Vidyalais, then SSB College, Mahapalakabada, BJM School, and all of, there are so many colleges like SCS College, PN College, Anchal College, Ramadevi College, and so many colleges. So I may not able to read out all their names, but these people, their all wishes are with us. And let us start our program. Now I request our Joint State Secretary, Mihir Patnaik, to start this program with Scout prayer. Whenever we do any program, madam, we generally start our program with Scout prayer. So during this prayer, someone has to lead. So now I request our State Secretary, Joint State Secretary, Mr. Mihir Ranjan Patnaik, to start with the prayer. Over to Mr. Patnaik.
Thank you, madam. Let's we'll all stand up. खड़े रहेंगे, खड़े हो जाओ। सब ध्यान, प्रार्थना शुरू। दया कर दान भक्ति का हमें परमात्मा देना, दया कर हमारी आत्मा में शुद्धता देना, हमारे प्राण में आ प्रभु आंखों में बस जाओ, अंधेरे दिल में आकर के परम ज्योति जगा देना, बहा दो प्रेम की गंगा, भिगोने प्रेम का सागर, हमें आपस में मिलजुल कर प्रभु रहना सिखा देना, हमारा कर्म हो सेवा, हमारा धर्म हो सेवा, ईमान हो तेरा, सेवक चल बता देना, वतन के वास्ते जीना, वतन के वास्ते मरना, वतन पर जात का करना, प्रभु हमको सिखा देना, दया कर दान भक्ति का हमें परमात्मा देना, दया करना हमारी आत्मा में शुद्धता देना।
Thank you so much,
Thank you.
Mishra.
बैठेंगे।
Now it's my time to welcome our guest. So in the midst of our program, as my principal is absent, so I had to take this chance. So in this way, I had to welcome our chief guest of this afternoon, Dr. Kaliprasad Mishra, the National Vice President and the former National Headquarter Commissioner and also present State Chief Commissioner of Bharat Scouts and Guides. He is in charge of Additional Commissioner, Indian Ambulance, New Delhi, Director General Kalinga Sanskriti Odisha, Director Indian Society of Social Welfare and Rehabilitation, the Chairman of Sishu Vikas Kota, the President of Freedom Fighters Successors Organization Odisha. He is also the life member of Indian Institute of Management and Marketing, Bharat Scouts and Guides, Indian Red Cross Society, Indian Ambulance, State Council for Child Welfare, American Welding Society, USA. See, he has received many awards and many honors. Out of them, very few are there. I'll just mention that is, he is the recipient of the Silver Elephant Award from the President of India in the year 1990. That is for the best achievement during his tenure, as he has conducted the international Jamboree, third Sar Jamboree and 13th National Jamboree in Odisha at Barunei in the year 1998. So then he is also recipient of the National Unity Award from the then Governor of Assam in the year 1993, Mr. Lokanath Mishra. He is also awarded with Fellowship Award with the President of India in 2010, highest award of St. John Ambulance, that is Askumar Amrit Kaur Gold Medal Award, and many more awards. If I'll go that, it takes another 1 hour. So I'll conclude here. He is also awarded with Sikitra C, Vidwan Baraputra Scout, Jyoti Scout C, and Scout Bhushan, and many more Scout Ratna, Balcher Bandhu by different Scout organizations within the state and outside the state. So I welcome you, sir, on behalf of my colleagues, on behalf of all the viewers assembled here, on behalf of the faculties of Mahasi College of Natural Law. Thank you, sir, for being with us. And with your presence, it is, it is a one sort of encouragement to all of us. Thank you, sir. And we are having Sthiti Madam, Dr. Sthiti Das. No, nothing more to say about a doctor. A doctor is always a doctor. The God, equivalent to God. So I don't take much time to say about her. Only thing is that she is the radiation oncologist, which is very rarest of the rare insofar as the MBBS course is concerned, job is concerned. So she has spared her valuable time with us That's enough, ma'am. I'm really thank you. I'm really obliged to you, ma'am, and I welcome you on behalf of all the viewers to this webinar, ma'am. Thank you very much, and thank you to I welcome Subhashree, ma'am, Subhashree Das, ma'am. She is the Director of Institute of Social Development. And as all of us know that she is very enterprising, very energetic and very dynamic. She has conducted many programs in Odisha. So far as the women and child is concerned, we have another session with her and we'll enjoy at that time. So at that time, I'll say something more about her. And you all will be knowing and watching her in our OTV, that is on the Saturday program, Asaro Alok. So many things we'll listen from her in the next, maybe on 26th or 27th, about women trafficking. We'll conduct one program. Madam has given her kind consent. Thank you very much. Now it's time to have our inauguration and start the program immediately. In this aspect, I'll ask our chief guest to inaugurate our webinar by lighting the candle. And now I request to inaugurate this webinar by lighting the candle. And I'll now request to just inaugurate. Just inaugurate. Yeah, just a minute, sir.
विश्वाधारं गगनसदृशं मेघवर्णं शुभांगं लक्ष्मीकान्तं कमलनयनं योगिभिर्ध्यानगमः।
Should I mute for now?
जयस्मिता पटनायक किए छे तो म्यूट कर दे नमिता अनम्यूट करो नमिता अनम्यूट करो
नमिता मैडम आपण म्यूट अछंती
अनम्यूट करंतु नमिता मैडम।
Now I request our chief guest, Dr. K.P. Misra, to deliver his inaugural address. Over to Dr. K.P. Misra.
नमस्कार am I audible
Yes sir.
Yes sir.
Please unmute.
am I audible now
Yes, sir.
Yes sir. Please continue.
respected Dr. STHITI Das, a very senior doctor of Apollo Hospital, radiation oncologist, respected Mrs. Subhashree Das, Director, Institute of Social Development, respected Dr. Namita Pattanaik, Assistant State Commissioner and Convener of this webinar, respected Srimati Anamika Das, State Organizing Commissioner of Bharat Scouts and Guides, respected Joint Secretary Mihir Babu, and all headquarters staff from Odisha and outside Odisha. respected principals, good afternoon to all. Cervical cancer. As we all know, cancer is a very dangerous disease which leads to ultimately painful death. Abnormal cell growth in any part of the body with potentiality to spread to other part of the body is cancer disease. This disease develops when the normal control mechanism fails or stop working. Old cells do not die, grow out of control, forming abnormal cells, that is cancer. These extra cells may form a mass of tissues called as a tumor and then develops to cancer itself. We have seen ads in the TV screen not to take alcohol or other drugs which are cancer-causing substance. A tumor in the cervix area of lower part of the uterus is called as cervical cancer. Long-lasting infection leads to this kind of cancer. This is perhaps more common in ladies, that will be confirmed by the doctor. This type of cancer, starting from the woman's cervix, may spread to lungs, liver, bladder, vagina, and rectum, etc. Dr. Namita Patnaik, Assistant Commissioner of Gynecology Wing of Odisha State Bharat Scout Guides, has very rightly chosen the subject because she belongs to the ladies' wing. I am grateful to her and thank her for understanding the dangerous problem for women and have convened this webinar. Information on this will be a great help to guide you. I am also grateful to Dr. BARIK Principal, who is continuously organizing, patronizing webinars in the different subjects. I am grateful to Dr. STHITI, who was busy treating some patient and came here. Thank you very much, madam. Mrs. SUBHASHREE, madam, thank you. You have come in right time and you are waiting for the program. I thank all the persons who are interested to join this program and know about cancer. Let us hear from Dr. Das. Thank you all again.
Thank you, sir. Thank you very much, sir. Thank you, sir. Now, we'll listen from our keynote address will be given by Subhashree ma'am. Subhashree ma'am, just within 2 to 3 minutes, you can start. Yes, over to Subhashree ma'am.
Thank you so much, Dr. Namita Patnaik, for giving me this opportunity to speak as a keynote address speaker. But I have nothing to say on this subject. But I'm not an expert on this subject also. But I welcome definitely all the guests, all the participants for this discussion. And of course, I welcome Dr. Kaliprasad Mishra, Dr. STHITI Das, Dr. Namita Patnaik, and all other guests who are present over here. Definitely, this will be a good session with Dr. STHITI Das. It is related to women, and mostly, I think most women participants are here to listen about the cervical cancer because we do not know about the cervical cancer. As I have heard, the cervical cancer is a cancer arising out of the arising out from the cervix, and it is the fourth most common cancer among women. So let us listen from the Dr. Das. She will speak on this subject, and she is a good speaker on this subject, and we'll listen to them. Thank you, Dr. Namita Patnaik, for giving me this opportunity. Thank you so much.
Thank you, Subhashree ma'am. I must be grateful to the PRO of Apollo Hospital, Mr. Anupam Jena. If he is there, will you please come up, Mr. Anupam Jena? I'm really grateful to him. Within 5 minutes, with the request of Subhashree ma'am, he didn't know me, but he joined and he asked me. He has not seen me also. He told, Madam, we know Bharat Scouts and Guide and we know Kalisa. So we want this program to be conducted by Bharat Scouts and Guide. I'm really grateful. So in this respect, I just want to tell one line about the Apollo Hospital. And Apollo Hospital, as we all know, it ranked #1 by the Times of India, the best hospital in Eastern region. And it is also, as you know, very, very pro patient and very helpful doctors, staff members, and uh, all the um, employees in Apollo Hospital. If you will enter and you will just say that I'm a scout and will just say I'm a guide, then they will just take off to the office chamber and they ask us what we can do. Instead, we ask them what we can do for them. They will ask to us, and they have very great respect for us. So for that, I want to salute not only to Apollo Hospital, to all the staff members, and including here Dr. STHITI Das. May I say the standing ovation to Dr. and with the salute, ma'am. Thank you very much.
Thank you so much.
I'm really grateful. And on behalf of Odisha State Bharat Scouts and Guide and on behalf of Mercy College, I again thankful to you for your valuable time. Now, just we know cervical cancer, as our chief guest told, uh, it is the third most common cancer in women worldwide. It is a disease that develops quite slowly and begins with a pre-cancer condition, which the doctor can explain to all of us. It is a malignant tumor. It derives from the cell of the cervix uteri, as we know, which is the lower part of the neck of the womb, the female reproductive organ. So it is among the most common preventable cancer with the highest morbidity and mortality. The World Health Organization recommends the visual inspection of the cervix with the acetic acid as survival, that is called as VIA. So the cancer screening strategy in which is very research for setting. So I'm not a technical person about that. I have gone through the literature and I could able to know this is very vital for all of us, those who are present, maybe male, maybe female, but it is very much required for all of us to have knowledge about this. So thank you very much. Now over to STHITI ma'am. Dr. STHITI Das.
Thank you so much. Respected Dr. Kali Prasad Mishra sir, Dr. Namita Pattanaik ma'am, Subhashree ma'am, and all the organizers from the Maharshi Law College and the Bharat Scout and Guides. It's really a great opportunity and it's a great honor for me to interact with you all because I'm seeing so many energetic people who have come together to discuss about such an important topic and such a less discussed topic amongst ourselves. Cervical cancer is actually the second most common cancer in women in India, but it is fourth in the world. And as per the mortality figures, it is also second only to breast cancer. So it is actually a very big menace to the society, more bigger because of the lack of social awareness which we have towards this disease, because once we utter the word cancer, many of us, I'm sure, will say, no, that is a disease and that is a terminal stage and no one can get cured. But let me correct you that this is a disease which, if detected in the early stages, like in stages 1 or 2, is curable up to 95 to 100%. So we should always know this thing that cancer, the word cancer, if it is diagnosed in early stages, it is curable. We should not believe that once cancer happens to anyone, it leads to death. So with this message, I'll start my topic, which is awareness on cervical cancer. Coming to the cervix. Cervix is actually a part of the woman's reproductive system. We all know that uterus is the part, or it is known as the womb, which actually harbors the fetus or the child. So the lower part of this uterus is known as the cervix, or it may be also known in the layman's term as the mouth of the uterus. So when cancer arises from this area, it is known as cervical cancer. So actually, if you see, cervix is an important organ which connects the uterus to the vagina. During pregnancy, it remains tightly closed. It helps in sustainment of the pregnancy, and during childbirth, it opens to allow the baby to pass. Hence, it is an important organ in the female reproductive system. Coming to epidemiology, as I already mentioned, it is second among all cancers in the women. It is also second in all cancer deaths in women, the first being breast cancer. But if you see 10 years back, cervical cancer was the first and foremost reason of cancers in women. This is because of poor socioeconomic conditions and poor sanitation, poor social awareness. It was the most common cancer in women. But 10 years down the lane, now breast cancer has become the first and foremost reason, followed by cervix cancer. As per the mortality statistics, it is also second to breast cancer. If you see the incidence, you can see it is 22.9% in case of 1 lakh of women. And every year, we at least see 1.2 lakh new cases in a year. So with this slide, we can understand the seriousness of the situation. It being the second most common cancer of women, we need to create several social awareness programs and events like this so that women come to understand about the signs and symptoms, risk factors, if at all we can prevent this disease, how to diagnose this disease, and if at all we get diagnosed, does the treatment lead to a cure? So with this, I go to the next slide, where we learn what may be the tumors in the cervix. We all know that there may be benign tumors also, which may be in the form of polyps, cysts, or genital warts. We need to understand that these are not harmful as cancer, and they don't invade the tissues around them. So if you encounter any kind of growth, or a polyp, or a cyst, or any kind of wart in the cervix, or in the vagina, or in the vulva, not 100% of these tumors are cancerous. There are some tumors only which become malignant growths or they form cervical cancer. Coming to the next slide, we all know cancer is a disease in which cells in the body actually grow out of control. So when this type of cancerous cells are found in the cervix, they are known as cervical cancer. If you see, all women are at risk for cervical cancer, and up from the age of 30 years and onwards, the risk for cervical cancer increases. The cause of cervical cancer, we know, is because of human papilloma virus or HPV virus, which is present in most of the women as an infection of the cervical tissue, and it actually passes from one person to another during sexual intercourse. At least half of sexually active people will have HPV infection at some point in their lives, but only few will get cervical cancer. So we need to understand that HPV viral infection is a very common infection in sexually active women, and in some point in their lives they will have this infection, but only few of them will have these cells transformed into cervical cancer. So what is the solution? The solution is primary and secondary prevention. This is one of the many, we know many cancers, but this is one of them where we can undergo a primary prevention by the use of HPV vaccine, where we can help prevent cervical cancer. Another prevention strategy, which is known as a secondary prevention strategy, is the screening test, which is most commonly, you must have heard this as the pap smear test, which is done in the comfort of an OPD, and it is a very easy test which is done within 10 to 15 minutes. It is a non-invasive, non-painful test, and it can be done from 30 years of women at every 3 years. It is routinely recommended. So these are the two things which can help us prevent the disease, which in the later slides I will explain. Coming to risk factors, we all have a question: what are the risk factors which actually increase our risk of contracting cervical cancer? For every cancer, there are some risk factors. For cervical, the risk factors are sexual intercourse before the age of 16 or within a year of starting your periods, having multiple sexual partners, birth control pills, especially for longer than 5 years, smoking cigarettes, having a weakened immune system, there's any immunodeficiency like HIV or any other autoimmune disorders. If already you have a sexually transmitted disease, then your risk of getting cervical cancer also increases. So these are the risk factors which actually increase the risk of getting cervical cancer. Now, how does an HPV infection may cause cervical cancer? Now, as you can see in the slide, this is the cervical area, and these are, in the cross section, we can see these are the cells lining the cervical area. So, if these cells are infected by the human papilloma virus, after some weeks, there will be viral replication. Now, these viral replicated cells, in a period of 2 years, may heal, 90% may heal. But in case of some immunodeficiency people, in a span of 10 to 30 years, this HPV DNA may get integrated into the tumor cell DNA, and then these cells may transform into invasive cancer cells. So this is actually a continuum of changes which may happen from days to weeks to months to years. Not every person who has HPV will have cervical cancer, but some people may be having a more risk of getting cervical cancer, and in these patients we can see this HPV DNA being integrated into the tumor cell DNA, and as a result, these cells get transformed into invasive cancer cells, which then spread across the body. So, as I mentioned, cervical cancer screening, actually most commonly we do pap smear tests, and less commonly HPV tests are done. Most recommended is a pap smear test. Am I audible?
Yes, yes.
Should I continue?
Yeah,
Yes,
please,
madam.
please.
Yes, madam. Yes, ma'am.
Okay. So let us come to the American Cancer Society guidelines for cervical cancer screening. This is a very important slide which we all must remember for the screening purpose, because for every cancer there is a certain screening protocol or a diagnostic protocol which we can follow. For cervical cancer, women under age 21 need not be screened. Women from age 21 to 29, a pap smear is recommended every 3 years. And it is mandatory. We should always go for a pap smear every 3 years, starting from 21 years. HPV test is not usually done, but it may be used as a follow-up test if we have an abnormal pap test result. So routine recommendation is pap test every 3 years. If a pap smear test is abnormal, then we may recommend for an HPV testing. Coming to age 30, once we have reached age 30, the preferred screening modality is pap test along with an HPV test, which is normally known as a co-testing. It is done every 5 years, which should continue until the age of 65. But in centers, if there is no HPV test, please don't get disheartened. Only we can continue with a pap smear test every 3 years. So the bottom line is, up to 21, you do not worry. Once you have reached the age 21 to 29 years, you can do a pap smear every 3 years. Starting from 30 years, generally co-testing is recommended, but in centers where it is not done, we can continue with normal pap smear test every 3 years up to the age of 65 years. So this is the cervix. Once we are doing a per vaginal examination or a per speculum examination, once we insert the speculum, so this is the image of the cervix as we see. So once we want to take a pap smear, what we do is we take a spatula and then it is rubbed along the borders of the cervix so that some cells can be taken. Now these cells are, this you can see here we have taken a speculum and we inserted inside the vagina so that we can see the cervix. So once the cervix is visible, the spatula is taken and it is rubbed alongside the cervix. So, there are two tests which are done usually. The spatula is rubbed alongside the outer side of the cervix, and there is a brush also which is inserted a little bit inside the cervix to take the endocervical tissue also. So this cells is taken in one slide and the endocervical tissues cells are taken in another slide. Both these slides are then stained and they are then studied under the microscope for study of if there are any normal cells or any dysplastic cells. So coming to normal cells and how they change into dysplastic cells and how they transform into cervical cancer. So once we have taken these cells and once we have seen these cells under the microscope, which is also known as the colposcope, which is directly, we can see this, we can analyze the cervical tissue. Here normal cells can be seen in this quadrant. Lower we can see low grade intraepithelial neoplasia where the cells have turned dysplastic but they are limited only to one layer. Here is a picture showing high grade dysplasia where the dysplastic cells are spreading and now these dysplastic cells have become frank cancerous. So again I would like to mention this is a continuum of changes and that does not mean once the moment you have HPV infection you will develop cancer. So this is a picture showing normal cervix and the cells removed from this cervix can be seen here and it appears in the microscope as these regular cells which are normal cervical cells. But suppose we look at the cervix and there is some kind of scarring or cervical dysplasia which is known as. So these cells when taken from this area will be appearing like this. Precancer cervical cells or cancerous cells where the cells are mostly dysplastic and you can see more than one nuclei. Coming to the cervical carcinogenesis. Now this slide actually explains how this HPV infection may turn a normal cervix into a HPV infected cervix and when there will be mild cytological abnormalities. Normal cells from normal cells they transform into HPV infected cells. Now if this HPV DNA gets integrated into the cervical cells, they get progressed into some precancerous lesions, like I mentioned, low grade CIN and high grade CIN. And once we see frank invasion, that means it has transformed into cancer. But again, this precancerous lesion again can be regressed back into the HPV infected cervix. But at this point of time, we need to actually diagnose that we are having this dysplastic cells or we are having a precancerous lesion. It can only happen if we are doing routine pap smear tests. So this is the crux behind this slide that if we are well aware and we are following the guidelines of doing pap smear and we are doing it regularly and we are also aware that there is some problem or there is some bleeding problem or there is some any kind of symptoms which are suspicious, then we need to visit the doctor immediately. Coming to the cofactors for progression of cervical HPV infection to cancer. So this slide actually shows us what are the other cofactors which actually increase the risk of transforming this HPV infection to cancer. First is long-term use of hormonal contraceptives. If you are using hormonal contraceptives from 5 to 9 years, the risk increases 3 times, more than 10 years, 4 times risk. Early initiation of sexual activity, the earlier you initiated, the more is the risk of getting cervical cancer. High parity means more than 2 children, like you're having 3, 4, 5 children, it also increases the risk of getting cervical cancer. Tobacco smoking, both active and passive. Other sexually transmitted diseases like herpes simplex, chlamydia, etc. Immune suppression or immunodeficiency. HIV infection, multiple sex partners, low socioeconomic status, and a diet poor in antioxidants. So these are the many factors which actually act as a cofactor for progression of the cervical HPV to cancer. So we should always bear in mind these all important points because these are actually the risk factors which we can control. Coming to symptoms. Signs and symptoms of cervical cancer, actually they arise late. And this is the reason in our subcontinent, patients present to us in a late stage of disease, mostly in stage 3. And this is the reason the survival rates are very low. And this is the reason people, once they think of cancer, they think that our date is given and we are going to die and we are not going to get treated. But if you now I'll elaborate all the signs and symptoms, and once you are cautious enough and alert enough, then you can actually be alert about these symptoms at a very early stage, and you can go to your doctor or to the cancer specialist, whoever it is, your nearest tertiary care center, and get yourself screened and evaluated and get diagnosed at the earliest. So the most important symptoms are bleeding that occurs between the regular menstrual periods, bleeding after sexual intercourse or while douching or while a pelvic examination, menstrual periods that last longer and are heavier than before, bleeding after going through menopause. After having menopause, there are some women who also present when they complain of bleeding per vagina. So these are symptoms should not be ignored and neglected, and whenever you face these symptoms, it is always important and good to meet your doctor and get yourself evaluated. Because many people, they have this fear that if we will go to the doctor, some negative report we will get. That is not the case. If you are going at a very early stage and getting evaluated, it helps us to diagnose the disease at an early stage. It may so happen that the diagnosis may not be of cancer. It may be of any other hormonal problems or any other problem. But at least we can go to a doctor and get ourselves examined. In the below slide, we can also see there are some symptoms of cervical infection or vaginal yeast infection. So these infections may present as a purulent vaginal discharge or a foul-smelling vaginal discharge. But sometimes some patients with cervical cancer also present as a foul-smelling vaginal discharge. So in these women also we need to evaluate them. Coming to the other set of symptoms which are always present in a local advanced variety, where we can see because of infiltration of the cervical tumor into the urinary bladder, there may be trouble in urinating. So this is easily seen in the late stages. There may be some swollen legs, like if there is a pelvic mass and there is impeding lymphatic drainage, so there may be swelling of the leg. If it is actually suppressing the ureter, there may be some kind of kidney failure. If there is some bone nets or there is some bone lesions, you may experience bone pain. There may be weight loss, pelvic pain, lack of appetite, and fatigue. These symptoms usually happen late in the disease, but like I said, in our subcontinent, because it is an internal organ, many women tend to miss these symptoms, and so they neglect it, and then the tumor starts growing, and these are the late symptoms which may appear. Coming to diagnosis, once we have these symptoms, the diagnosis is usually done. This is also a very easy test which is done by a speculum study of the cervix, upper vaginal and upper speculum study is done. And if there is mass seen or any suspicious lesion, then we do a punch biopsy or under cervical curettage or a bone biopsy. So these are the tests by which we take some tissue from the tumor and we again study it under the microscope. And once the diagnosis is made, the first and foremost thing we do is staging. We all know that cancer has 4 stages: stage 1, stage 2, stage 3, and stage 4. Once the diagnosis of cancer has been done by this biopsy, then we go for staging, which is generally the FIGO staging, which is done. And mostly stage 1 diseases are very small tumors and they are restricted to the cervix. Stage 2 is just spreading across the cervix to maybe to the uterus, upper part of the uterus or lower part of the vagina. In stage 3, it is spreading into the nearby tissue, which is most commonly known as the parametrium. In stage 4, the disease from the cervix is invading into the urinary bladder, rectum, this is the rectum, and it is causing problems in urination and defecation. And in 4B, it has already spread to the liver, lungs, bone, or brain. So these are the different stages. And this is a very important slide because if your disease is being diagnosed and detected in stage 1 or in stage 2, your cure rate will be 95 to 100%. The 5-year survival will be more than 95 to 100%. But stage 3, it comes down. And if it is diagnosed in stage 4, it will be a mere 50%. So now we understand the importance of early detection of cancers. Coming to the treatment options are many, starting from surgical treatment options, surgery, to radiotherapy followed by chemotherapy and palliative treatment. The choice of treatment will always depend, as I said, upon the staging, fitness of the patients, age of the patients, type of the lesion, and the resources available. The classical surgical procedure which we usually do is a total hysterectomy with bilateral salpingo-oophorectomy, or it is known as the Virgin's hysterectomy. But there are some cases where if there is a very small disease, a very small tumor, and it is in the stage 1A category, and the patient is a young woman and she wishes to preserve her fertility, there is a surgery which is known as radical trachelectomy, where only the portion with the disease is removed and the rest of the uterus is preserved so that she can have her childbearing functions. So after surgery, the next treatment which we offer is radiotherapy, and let me tell you, this is the most common treatment we give because most of the patients are diagnosed in 2 and 3 stages where already the disease is advanced and there is no scope of surgery. We have to treat the disease with radiotherapy. But let me tell you that please don't get disheartened, even if radiotherapy is done. Not that many people believe that surgery is the only option for cure. No, radiotherapy along with chemotherapy, it is also a definitive treatment for cancer cervix, and along with radiotherapy also, we can treat the disease fully with a 100% cure rate. And owing to the new techniques available with us in the Apollo Cancer Centers, starting from image guidance, intensity modulation, TrueBeam HT machine, which we have now in our campus, we can actually treat tumors in a very consolidated manner where other organs, rectum, like the urinary bladder will not be, and there will be negligible toxicity to the patients. Chemotherapy is another modality which can be treated, which can be used for treatment of this cervical cancer. Mostly it is added as a cisplatin drug to standard radiotherapy procedures to improve the outcomes, or it may be used for metastatic diseases where already stage 4 disease is there, where we can use a number of drugs. So follow-up is also as important as treatment. When we have finished treatment, it is very important for patients to come in 3 to 6 monthly intervals to get regular checkups, and along with clinical examinations, we also advise for pap tests and other tests as per the patient's symptoms, so that patient is on regular follow-up care. Coming to the burning question nowadays, how can we prevent it? Because all said and done, we know everything about the disease, but is there any way we can prevent it? Yes. For cervical cancer, it is a big yes, because with HPV vaccines, we can prevent this disease. And the 2 vaccines which are available to us, and we can use this, are Gardasil and Cervarix. Gardasil is a quadrivalent vaccine which gives us protection against type 6, 11, 16, and 18. And Cervarix gives us protection against type 16 and 18. It is usually made by recombinant DNA technology and it is widely available in our country. For Gardasil, you can take this vaccine if you want to prevent cervical cancer, vulvar cancer, cervical dysplasia, and even genital warts. Because it is a quadrivalent vaccine, it helps us to prevent all these cancers. If you are taking Cervarix, it is only indicated for prevention of cervical cancer as it is a bivalent vaccine. Gardasil's vaccine's efficacy is 98 to 100%, Cervarix is 92 to 94%. The doses recommended are 3, first, second, third. First is given on any date, second 2 months after first doses, and third 6 months after first dose. 0, 2, 6. And Cervarix it is given as 0, 1, 6. Side effects are not many. It has a favorable safety profile. There may be some injection site reactions like erythema, pain, and swelling, or pruritus. For special population like pregnant women and lactating mother, it should be avoided. So now I'm summarizing it. Cervical cancer is one of the leading causes of cancer in women, along with mortality. It is mainly spread by skin-to-skin transmission of human papillomavirus. Regular pap smear and HPV testing are recommended and it helps us in early detection and secondary prevention of the cervical cancer. So we understand prevention is better than cure. Thank you. With this, I come to the end of the session. Any questions?
Yes, thank you, madam. Now, question, you may ask question to ma'am. Very informative, and madam has already explained about the signs, symptoms, the treatment, the prevention, everything. So, if you have got any doubt, please just unmute yourself and ask. And here I will just request all the participants, you please write down your name and institution name so that you will get a certificate. So there will be no feedback form, only your name and institution name will be there on the chat board and I will take note of that. Thank you very much. Yes, please ask question.
Madam, is there any specific age for the vaccination?
Usually we recommend it from the age of 11 years as early as possible for young girls, and as per the recommendations, before the start of any sexual activity you should administer the vaccine.
Okay.
Because once you're sexually active, then you have a propensity of getting that HPV virus infection. So before this activity is initiated, only we have to be immune to the infection.
It is available anywhere?
Yes, it is available.
Any Pradeep Sahu, is there any question for you? Pradeep.
Ma'am, yes,
please ask.
I want to know about the Ayurvedic treatment for cervical cancer.
How can I get it from a doctor, MBBS doctor?
No, I have no idea about Ayurvedic treatment of cervical cancer.
Thank you.
Okay, anybody else is there? Any ma'am, any sir? It is the last part. I'll just honor our guest of this afternoon with a very small and pleasant honor of certificate of honor. If you like to just see, I'll request our guest of chief guest of this evening, Dr. K.P. MISHRA, to present the certificate of honor. And now I'll present that. Just a minute. Okay.
Send it physically to Apollo Hospital.
Definitely, sir. Definitely, I'll send. Just now.
Meantime, I will know Dr. Das. Are you from Rajiv Gandhi, Delhi? No.
No, sir. I am from Fortis. I did my fellowship in Fortis, Gurgaon. Fortis Memorial Hospital.
Achha. Your face is very familiar. So I thought you may be rather going to Delhi. Anyhow, Gurgaon is very nearer to Delhi.
Mama, okay.
Just a minute.
Again.
I'll present the certificate so that sir will honor is presenting. Okay.
So, Mama,
Thank you.
Mama, koi do.
Just please mute. Please mute yourself.
मैं बंद कर देंगे. नहीं ସେଇଟା ବେଶୀ ବ୍ୟସ୍ତ ନାହିଁ ସେଇଟା ଖାଲି switch off କର.
Okay, just mute yourself. Anybody else is there? Sir, is it visible, sir? Sir, it is visible?
Yes, 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 yes.
Okay, sir. May I request our Chief Guest, Dr. K.P. Mishra, to present this honor certificate of honor to Dr. STHITI Das, ma'am. Okay, madam.
Thank you so much.
Whatever sir told, physically it will be reached to you, ma'am. Thank you very much.
Thank you so much.
And now I request.
Thank you.
Yes, sir. Now I request. Okay. Subhashree ma'am, are you there? Subhashree ma'am. Sir, is it visible?
Visible.
Yes, sir. This is a small token of love to Subhashree ma'am. Subhashree ma'am, are you there?
Yes, yes, I'm here.
Okay. So, on behalf of Bharat Scouts and Guide, on behalf of Mahasi College, may I request our chief guest, Dr. K.P. Mishra sir, to hand over this virtually to Madam Subhashree ma'am.
Thank you so much, sir. Thank you so much.
Certificate cannot be handed over virtually.
Yes, sir. Yes, sir. That I know. Thank you
You
so much.
send it to them. You send it to them.
Yes,
Okay,
surely, sir.
okay,
Thank
sir.
you.
And for the it will be honor for the children, for the participant, for the viewers. They are always asking for certificates, and this time sir has given a very nice certificate. I just want to present it before you so that all of you will see what type of certificate presenting now. Just a minute. I'll share it. Yes.
ଯୋଉମାନେ ପରେ ଆସିଛନ୍ତି କିମ୍ବା ଅଧିଷ୍ଠିତ ମ୍ୟାଡାମ ଭଳିଆ ତାଙ୍କ ନାଁ ଇନକ୍ଲୁଡ କର.
Aଜ୍ଞା sir. Aଜ୍ଞା sir. Okay, sir. This is the certificate I just want to show you. This has been. Yes. Okay. Yes. This is the certificate. And our guest also given his kind consent to certify your certificate. So this is the certificate will be issued to all the participants. Thanks to City Madam, thanks to our chief guest. They have given their kind consent. They have put their signature on your certificate, and you will get a very good certificate. Sir was told very nicely that those who have attended maybe lately due to some internet connection or something else, but all of you will get this certificate. So thank you, sir. Thank you very much. And I'm really grateful to ma'am. Now, it is time to express our sincere gratitude to Dr. STHITI Das and Dr. Mrs. Subhashree Das. May I request another Das, Mrs. Anamika Das, our State Organizing Commissioner, the National Executive Committee member, and the International Peace Awardee, Madam Anamika Das, to present vote of thanks, to extend a heartfelt vote of thanks to our invited guests. Over to Mrs. Das. Over to Mrs. Das.
It is my proud privilege to extend vote of thanks on behalf of Odisha State Bharat Scouts and Guides. I extend my vote of thanks to Dr. K.P. Mishra, National Vice President and State Chief Commissioner, Odisha State Bharat Scouts and Guides. I extend my thanks to Dr. Madam STHITI Das and Madam Subhashree Das, and the convener of this webinar, Dr. Namita Patnaik Madam, and friends from outside Odisha also. The way Madam STHITI Das explained about a dangerous disease, the way was so beautiful. Rather, we scare of that disease. I have started loving her face, and the fear which we have in our mind, or name cancer itself is a fear in our mind. It is a trauma. But the way Madam have dealt with us, the way she has explained nicely, I feel the patients are really lucky who get the opportunity to be treated in the hand of Madam STHITI Das. And Madam Subhashree Das, who is very famous in doing activities for little children. I really thankful to Madam Subhashree Das also, as she has given her time to be with us. Dr. K.P. Mishra, who was the backbone of Odisha State Bharat Scouts and Guides, who has always motivated units to go ahead for different type of webinars, seminars. During this pandemic also, he has given all the liberty to cover all the needs of young children. As Madam STHITI Das have told, the vaccination should be at a very young age. That means this education should be given at very young age to young girls. At the age of 40 or 40 plus, I am getting this knowledge. I think that cannot be so helpful for me, but that can be helpful for my daughter or for my relatives or for somebody else's daughter. So this is really very informative. This is really very helpful. And actually, we don't know. This was also a news for us. The death of this disease is in second highest position. This is really very shocking for us, and for all the ladies in this group, whether they are mother or single, whether they are of very high age or of young age, all this knowledge should be received and should be taken positively, and should be really it should be kept in our heart forever. These can prevention is always better than cure. So if we have a little bit information about any disease, not only about this, any disease we can prevent to be cured. So thank you again, Madam, on behalf of Odisha State, entire team of Odisha State. You will be happy to know Bharat Scouts and Guides is the largest youth organization in the world. So this can be a chain. This information can be spreaded to entire India, and because we have friends from Maharashtra, we have friends from Andhra Pradesh in this group also, so this message will reach corners of India also. So thank you for being so motivative, and being a lady, I feel proud that I am meeting such a glamorous, such a beautiful lady. You are not looking, if the apron is not there, you might be looking like a film heroine. So we are really very, very thankful for you. The beautiful smile. God bless you. On behalf of all of us, I can only say God bless you, Madam. You just treat a lot of people with your smile. That can be half recovery for a patient. And we can bless you. We can bless you only. And I again thank Maharshi College, who is taking very interest to different type of webinars they are organizing since last a month. Just after this webinar, within 1-2 days, they are going to take us to the universe. We are going to know about stars, moons, and all this. So different types of webinars they are giving us to be a part. For that, I thank the principal of the Maharshi College, and I thank Dr. Namita Patnaik Madam. I again thank our Dr. K.P. Mishra sir, and thank word is very less for Madam Sthiti Das Madam. Thank word is very less. We cannot say you thanks, or we cannot say you bye, because you have acquired a very special place in our heart. I think all the members present in the webinar, they all are very happy. If I see each person's face, they all are having a beautiful smile on their face. That smile may be contagious from you, madam. So I thank you again.
Thank you so much. Thank you so much for your very, very generous words you have told. And I'm really feeling honored to be and interacting with you all. It is such a big group. And it is my request, if I've actually, like, I have made an impact on you all, please spread the message. And it is our duty to spread this message to everyone. Not only women, but also men should come forward and they should spread this message that early detection of cancer actually leads to full cure and good survival rates. Thank you so much.
Dr. Das, may I request you, we have about more than 2 lakh girls in our organization in Odisha itself. So may I request you to permit, Namita is recording this program, so we can play this program in all our golf camps.
Yes, sir. Sure, sir. Sure, sir. It will help us to reach out to many people. Those who don't know.
Please note it. Please note it. And we can do that in all our rangers and guides camp.
Yes, sir.
Yes, sir. And I'm always with you all. Even if you need me for any other program, you can always approach. And I'll be more than happy to be a part among you all and spread this awareness. Thank you so much.
In the first slide, Dr. Das, in the first slide, I missed your telephone number.
Sir, I'll give you, sir. Sir, I'll give you, sir.
You want to see the slide, sir? Want the number? I'll just tell you, can note it down.
No. What I said, in the first slide, you mentioned your telephone number, which I missed. I could not record it. Today I will get it, Namita.
Sir, I'll share it. Sir, I'll share it. Sir, I just want to extend Bharti bottom thanks to the man behind the screen. He is none other than our Mr. Anupam Jena. He is the public relation officer. If he is there, please unmute your video, please. And I am thankful to Madam Geetanjali Panda and Bina Madam from Puri. Both of them, they are from Puri and they are the life member of Youth Red Cross life member. Geeta Madam, thank you very much. He is always with us. And Bina Madam, this is Das, Dr. Vijay Das, and this is the Lions Club President, Chairman. And Mr. Kedar Patnaik is also there. He is the President of the Fun and Fitness Club. So all these valuable persons, including my robot staff leader. Yes. Thank you very much. Mr. Manoj Kumar Mansingh, our robot staff leader, all of them behind the screen. Yes, just thank you, Anupam. Thank you very much. We'll have another program. We'll have another program like this.
Yeah, sure.
Another announcement for my children that Anamika Madam has already told you. We are having the seminar on web. That is from tomorrow, 23rd. It will continue for 24th and 25th. It is also from the mercy of our chief guest, our Vice President, Dr. Kali Prasad Mishra. On that day, he has told Mr. Dr. Subhendu Patnaik, the Deputy Director, Pathani Samant Planetarium, he told that there will be a program, and immediately I rushed to him and I telephoned him and I made him agree because they are very busy people. So I asked him to give us a consent, and he has given 23rd, 24th, and 25th just this month. From tomorrow onwards, for 3 days, we'll have the webinar for from timing is from 4 to 5. This is very important for all of us because the topic is mysteries of universe, and individually it has got 3 parts. Part 1 is unraveling the universe. That means Vishwara Abodharana. Number 2 is part 2, our position in the universe. Vishware amara sthiti. And the third one is celestial hide and seek. Akasare luchokali khela. So he will explain all things about these things. So my request, my humble request, please join before time, so that once I start recording means the domain will not allow the person to join. So that is the thing. So please join in time. And once again, if we don't have anything much more to say, on behalf of all of you, as Anagnika madam has explained, has already narrated, and I also extend my heartfelt thanks to ma'am, Dr. Sthiti Das. Really, you are not only good looking or beautiful, your heart is so beautiful that it could have been, we could have seen from your face. So thank you very much, ma'am.
Thank you, ma'am. Thank you, ma'am.
Some other time also we'll have, there are so many problems with the children and particularly with the ladies. So I'll request you, ma'am, if you just share sometimes in between also during this pandemic may continue for maybe 3 to 4 months again. So during that also we can have another 1 or 2 more, so that these girls, these women, they will be very happy and we will break the silence. I just want to do this webinar only to break the silence. We are just sitting idle at home. So by listening from you means we are gaining knowledge. By gaining knowledge, we are empowered. So because we are getting information, so we are empowered. So thank you for empowering us. Thank you so much, sir. And now I ask permission from our Vice President or the State Chief Commissioner to close the function, to close the webinar. May I request, sir, to give me permission to close the. Am I audible, sir? Am I audible, sir? Am I audible?
Yes, yes, ma'am. Yes,
Sir, sir, could you give me just permission to close this? Sir, could you permit me to close the function, please? Today, my principal, he is busy in somewhere else. So, being our father, being our guardian, and being the overall, not only our guest, but also our pathfinder, so motivator. So, I just want to ask permission from you, sir. Could you please allow us to close this webinar? Any question, Bina madam or Gitanjali madam?
ना मुझे स्थिति मैडम को टिके बहुत थैंक यू देवी कहना एते सुंदर से कहले एते सुंदर प्रेजेंटेशन आ तंको सबुठ बहुत बढ़िया लागला तंको टोन टा एते स्मृति मधुर आ बहुत सुंदर लागला सुनिया पे देखिया पे आ बुझी समस्त बुझी निश्चित भाबरे आ जहार जहार प्रॉब्लम निश्चित भाबे जीवे
Geeta madam, do you like to say anything? Geeta ma'am? Yes. Geeta madam, unmute. Please unmute yourself. Geeta ma'am, please unmute yourself. ଆପଣଙ୍କର okay. Yes. Geeta ma'am, ଆପଣଙ୍କର voice सुना जाउनी, एटा टिके खोली दियंतु, स्पीकर टा ऑन करंतु, स्पीकर टा ऑन करंतु. He is the first aid lecturer, sir.
अरे गीता रो गोटे अन्य जिंस कहलुनु ही से सेंटर रो जॉइंट सेक्रेटरी मटियो.
Oh, sir. Sir.
बा बहुत सुंदर है मैडम.
Thank you very much.
Thank you, welcome मैडम.
Thank you. मनोज साहू sir, thank you.
माने मोलाला अनक तुमर सिमी कहू मोबाइल टाइम 10 बंद हे गेला.
ओहो, okay. From St. John ambulance. Okay.
हां ले मो सेंट जॉन प्लस रेड क्रॉस.
Yes, yes. Thank you very much. We'll conduct some more also, and during this pandemic also, we'll do some more programs for the privates and for the students and the youth rectors, volunteers also.
many thanks ଆପଣଙ୍କୁ ବହୁତ ଧନ୍ୟବାଦ କାରଣ ଆପଣ ବହୁତ ସୁନ୍ଦର କାର୍ଯ୍ୟକ୍ରମ ସବୁବେଳେ କରୁଛନ୍ତି
Thank you. It is all of your inspiration that could organize such a big webinar. That is possible only for your presence. Unless you people are there, there will be no webinar. And always my guru
madam,
is there.
बहुत नमस्कार.
My guru is there, so my guru is there means I am proud of him. Yes, Kedar Patnaik sir, would you like to say anything? Mr. Kedar Patnaik sir? Okay, so there are 18 members joined from from this fitness fun and fitness club Bhubaneswar. I'm thankful to them. Thank you, Dr. Prakash Chandra Panigrahi, the senior faculty of DAB School, Kalinganagar. Individually, I just extend heartfelt thanks to all of you. You have joined. After all, your busy schedule is there, but you left that and you joined with us. You joined with us heartily. So on behalf of all of us, I just thank you. Vishwajit, thank you very much. Mr. Mahapatra, Vishwajit Mahapatra, thank you very much. You are on the way. Okay, sir. So, could you, sir, please allow me to close the webinar?
Please go ahead.
Thank you, namaskar.
Thank you very much. Now I'm going to close the webinar. Thank you. I'll close the recording. Stop the recording. Stop the streaming. Stop the streaming. Yes.
ସମସ୍ତଙ୍କୁ ନୂଆ ବର୍ଷ ଉପଲକ୍ଷେ ହାର୍ଦ୍ଦିକ ଅଭିନନ୍ଦନ ଆଡଭାନ୍ସ.
Okay. I'll record it. I have recorded.
ତା ପୂର୍ବରୁ ଆହୁରି କେତେ ଗୁଡେ webinar ହବ?
ହଁ ସାର୍, ଚାରିଟା ହେଇପାରିବ. Okay, sir. Thank you, ma'am.
Good night, Dr. Das. Good night.
Good night, sir.
ସମସ୍ତଙ୍କୁ ନମସ୍କାର. Thank you.
ନମସ୍କାର.
Thank you so much, ma'am. ସମସ୍ତଙ୍କୁ ମୋର ନମସ୍କାର.